Are you doing exercises every day, every other day, every week without a plan? You need a plan, and I'm going to tell you exactly what you need on this week's Monday Moves with Marian. Hi there, it's Marian, and happy Thanksgiving to my Canadian friends. And I know it's not Monday, it's Tuesday. But because we had a holiday in Canada, I am coming to you on Tuesday. Took a little break and enjoyed time with family yesterday. And today, I want to talk to you, now that we are in Canada anyway, done with turkey and stuffing and pumpkin pie and mashed potatoes and all the good stuff. Sweet potatoes too, can't forget sweet potatoes, love them. But what I want to talk to you about today is whether or not you have a plan for the exercises that you've been doing since diagnosis. And I know sometimes it is the furthest thing from your mind. You are not thinking about exercise at all, but you've also heard that you should be exercising. You've also heard about the amazing benefits of exercise. So if you haven't, I need you to jump in and either grab my free download of all the amazing benefits for cancer patients with exercise, or send me a DM or a message and I will send it to you, because you need to know that. Once you know that, you need to have a plan. You absolutely do. Because depending on what phase you are in your journey since diagnosis, there are certain things you should be working on. And sometimes it's easier to describe this in something we're more used to, which could be such as an orthopedic injury, like to a knee. You've done everything you could, but sometimes things happen and you're going to end up with a diagnosis. Knee injury, breast cancer. Now, I don't want you to think I am comparing these two things as equal. What I'm showing you is the phases of exercise and how they should be working for breast cancer patients, and they're working amazingly well for someone with an orthopedic injury. So we are looking at prevention on both sides. That's what we would like to do, but if that can't happen, then we have to look at treatment. So if you go to see your doctor and your doctor says you need surgery, you are going to do what you need to prep for that surgery. This is the prehabilitation stage for breast cancer patients. Now, you may have heard that word, but this is the exercise that occurs prior to treatment. So you've had your diagnosis, you're going in for treatment. Now, this could be pre-adjuvant chemotherapy, pre-adjuvant radiation, or this could be surgery. So prior to that treatment, we are looking at prehab. Just like the surgeon would say to the knee injury patient, I want you to get as strong or as flexible as you can before we do surgery, because once surgery occurs, you are going to be trying to ramp yourself back up to where you want to be. And that's how prehab works for breast cancer patients as well, is you want to get yourself in as best a position as you can physically, and it will help mentally as well, of course, but you want to be in that best position prior to having treatment, which will drain your body from an energy standpoint, from a strength standpoint, range of motion, and weakness and fatigue. So we want to do just as society has indicated for orthopedic injuries, we want that for cancer as well. So let's look at the second phase. Prehab is the first. Let's go to the second. And that's where we're looking at post-surgery. So this is where we're looking at movement therapy. We know for the knee injury patient, when they come out of surgery, there will be bandages, there will be wraps, there will be things that can restrict range of motion, there will be swelling, there will be decreased ability plus grogginess and issues that may come from anesthetic. Exactly the same with breast cancer surgery. There will be wraps, there will be decreased range of motion, there will be side effects from the anesthetic, there will be a stay in the hospital. All of these things are the same. But one of the things that is really interesting is how much information is available to orthopedic patients after surgery. You will know to work progressively. You will know to start with range of motion. You will know to move to strength training after you've got good mobility in, we're talking about the knee right now, so we're going to say knee. But when you look at that gap, when you look at the information for breast cancer patients, you may find everything from don't move for a week to use your arm as much as you can as tolerated, to do whatever you can, to here's some stretches to try. There's no protocol that's being provided. Patients can be overwhelmed, not only because of fighting the disease itself, but because of not having a protocol, not being referred to a therapist, not knowing exactly what to do, and having such a difference of information. This is where that gap comes in, and this is where I'm so passionate about you starting your exercises. Right after surgery, as soon as you get consent from your surgeon, I want you to start moving, because that's what they do with a knee injury patient. As soon as you can, you are going to move your toes, you are going to move your ankle, you are going to move your hip. Even if you can't move your knee, you're going to move all those other joints. You've got crutches to get up and start moving as much as you can. So we need to apply this same standard for post-surgery breast cancer patients. I want you in movement therapy. Movement therapy is aimed at getting that range of motion back, and that's what I want for you. Once that range of motion is back, you can start working on, as you know, mobility, then stability, and then strength. I believe it is very important to label these phases, and this is the movement therapy phase. This is where your primary goal is working on range of motion. This is the phase of exercise where you need to get mobility back because of the treatment of surgery. When you go through, or if you go through treatment with chemotherapy or radiation after surgery, this brings in a new phase of exercise where we want to look at the specifics that we need for the phase of exercise when your body is being depleted by the chemicals, by the treatment that is fighting cancer. And it has risk factors and benefits, and this is why I want you to be key in focusing on the program and the protocols you should be using depending on where you are. When you start with the basics, you'll know where you are in that journey and how to work within that specified phase to get the best benefits for you as you go through that phase of treatment. So when you're going through chemotherapy or radiation, your body is going to react much differently because of treatment than it would have when you're in the prehab phase. So we are looking at decreasing the fatigue as much as possible. We are looking at keeping energy levels as high as we can. We are looking at specific protocols of whether or not you're allowed to exercise based on the time frame after treatment. Those are the things that will be key in this phase of exercise called CATex, so concurrent with adjuvant treatment exercise. We want to limit the muscle mass that can be lost during this phase of treatment, and we also want to do as much cardiovascular exercise as we can, because we know, research has told us, and we've seen it with patients, that doing your cardio will actually help your fatigue. So unlike after surgery and that phase of movement therapy, we have our mobility back. So now we're working on the cardiovascular and activities of muscle mass. Then what we also want to look at now is the fourth phase of exercise that occurs during survivorship. So I want you to take a look at this as post-treatment exercise. Prehabilitation to get your body geared for treatment. Movement therapy after surgery to get back your range of motion. CATex during treatment of chemotherapy or radiation to limit the negative effects to the body and to make sure we reduce fatigue as much as possible. And once you are done with treatment, we need to look at survivorship exercise protocols. What we have to watch for with post-treatment exercise is side effects that can occur because of treatment. So we need to look at things such as peripheral neuropathy. We have to look at the strength of our bones, and we have to look on whether or not you are on any long-term treatment that may have effect with how you are active. So your program is important, but the benefits are amazing with up to 50% reduced risk of recurrence with proper exercise protocols. That is amazing, and that is what we should be striving for with your exercise program. So I want to just review again to make sure that you are working within the scope of your journey for the exercise phases that are going to enhance and give you the best benefits you can from exercise. Rehabilitation to get your body ready to fight. Movement therapy after surgery to get your range of motion back. We have CATex, which is going to help you decrease fatigue and keep as much muscle mass as possible. And then your survivor exercise, which is going to look at risk factors that you may have had and work on an overall program to decreasing the risk of recurrence. And that's what I want to make sure you're looking at with your exercise program. So I have put together a little video that will take you through the 4 phases with the phases of breast cancer treatment. And of course, if you have any questions, I absolutely want you to reach out to me via email or DM. Ask me questions about the phases and how they work. If you didn't get that full range of motion back after surgery, should you be working on it during chemo? These are all questions I would be more than happy to help you with. The other thing I would love for you to do is subscribe to my YouTube channel. I would like you to make sure that you have all of the Monday moves available to you to add to your program, and this knowledge is power information. It will absolutely help you get the best out of each exercise, know your phases, and know exactly what you should be doing as you go through your journey and you work so hard to get the benefits of the energy that you're putting in. So please subscribe. And again, any questions, just let me know. Have an awesome Tuesday, and I hope you enjoyed this Monday Moves. Take care.